I am Mary Alale Yusuf. The heart, which is the strongest muscle in the body, is divided into 4 chambers. Blood is pumped from the left chambers into the arteries, supplying oxygen to all the organs of the body. The blood is returned to the right chambers of the heart via the veins, losing impurities on the way through the liver. Broadly speaking, the term cardiovascular disease, or CVD, is used to describe diseases of the heart and blood vessels. According to the World Heart Federation, the approximate number of deaths per year from cardiovascular diseases is 17.3 million, 80% of which occur in low and middle income countries. About 7% of these numbers take place in Africa. Today we'll be talking about the heart attack, an all too common CVD, with Professor Janet Ajuluchukwu, a consultant cardiologist at the Lagos University Teaching Hospital, Idi-Araba, and a lecturer in the University of Lagos. You're welcome to the show.
Thank you, ma'am.
But before we start, we'll take a short break. We'll be back after this. Welcome back. Now let's get to the heart of the matter. Dr. Ajuluchukwu, so nice to have you here.
Thank you. It's a great pleasure for me to be here.
Do tell us, because a lot of people don't understand, when a heart attack happens, what really is happening in the body?
Well, you see, the body needs oxygen, blood, and nutrients. So a heart attack arises when, for the reason of obstruction to the vessel itself supplying the heart, it's blocked, obstructed, and then the heart itself, or a segment of the heart, does not receive its own oxygen and nutrients. And then the name is very, very apt. So there is an attack. The heart literally says, "Whoa, what's going on?"
Okay, I guess that's what they call astonishment of heart in the Bible.
Yes, yes. That's a good one too.
Okay,
Yeah.
so it's caused by a blockage. Now, are there some warning signs? Can somebody actually know this thing looks like it's coming on, let me do something? Is there something like that?
There is a spectrum, and the spectrum goes as follows. We have a stable type where there is an obstruction, and whenever you walk the heart to the level where it is not being supplied enough, when the obstruction is partial, then you have what we call angina or angina.
That's pain.
That's chest pain, and it is predictable. Whenever you lift a bucket of water or you climb to the first floor, same level of exertion will, trouble the heart, and it tells you, I need to stop. So that is the stable type. Then we go on to another stage where the obstruction gets worse, or it has, the plaque, the fibrous tissue, or the cholesterol plaque ruptures.
Okay,
and then
we're looking at a little film now. That's something building up there?
Yes.
I guess
yes.
those red things are the cells.
Those are the red cells, and they're having trouble passing through. You can see them clogging up.
Yes.
Clogging up on that spot. And you can see the big yellow, plaque there.
So
and
oxygen is not getting beyond that.
It's not getting beyond that point. So all the vessels being supplied by that particular vessel would now have a problem.
What's that blue patch?
The blue patch is the area that is dying. The area that is dying. And then you can see that somehow the blockage is relieved, and that person would not have a full heart attack, but would have what we call, a warning.
Okay.
And then, or what we call, acute coronary syndrome. Then it's building up again. And when the build-up is so complete that the muscle dies, then that is what we call a heart attack. So a patient or an individual can be warned when the build-up is coming on. And then the build-up is about when the obstruction is about 50% to 75% of the lumen of the hole, So that can be a warning that whenever I want to do a certain amount of work, I have pain, and that pain would be in the center of my chest, not on the left side.
In the
center of the chest. And then if you see many pictures of people having a heart attack, they bend over and they are holding the front of their chest.
Okay.
So the heart is on our left, but the
The
pain and the discomfort is in the center of the chest.
Is that the only sign? Because a lot of people would say they have chest pain. They use some sort of hot balm and forget about it. Oh,
No.
I must have done too much.
No, the chest discomfort is can come from many diseases. A peptic ulcer can cause, I always tell my clients that the chest is like a container, it's like a bucket. It contains the gullet, it contains the lungs, it contains the heart. Even the skin over the chest can generate pain. So discomfort can come from any of these internal organs. But the one that everybody is worried about is the heart. But the heart is not the only organ in the chest.
That causes discomfort.
Yes, but we have some risk factors.
Okay. No, but before we go to risk factors, is that the only sign?
No.
Just the chest pain?
No, the chest pain is a cardinal one.
Okay.
Remember that the job of the heart is to supply, and it will supply blood, oxygen, and nutrients to the whole part of the body. So when it is deficient in its job, there might be dizziness because the brain is not getting blood. There would be chest pain because the heart is not getting blood. There will be weakness because all other parts of the body
are being starved of
oxygen. Of blood and oxygen. Then it's like a lightning. The dying cells can just be irritable and then cause what we call an arrhythmia, an abnormal rhythm. There is an electrical control of how the heart works. Like you said previously, we have 4 chambers, but those 4 chambers are controlled by a very, very beautiful electrical network that allows the heart to be coordinated. So it
goes off beat.
It goes off beat, and then it's like a lightning, and then everybody can do something, and then that can just stop the heart at that point.
Oh, when there's an arrhythmia, we're almost at the end of the whole thing.
Yes.
It's not like somebody says, my heart is beating funny, let me go to the hospital.
It might just be a short one, or it might be the end of the story. In 25% of people having heart attacks, they have an arrhythmia that is lethal. We call it a malignant arrhythmia, ventricular fibrillation, ventricular tachycardia, and the heart stops. That is where one of the outcomes of a heart attack is a cardiac arrest.
Okay.
And then, the cardiac arrest, treatments can now come in, and that is
okay, let's go to the risk factors. What would these be?
The risk factors, we've always wondered, is it nature or nurture? A risk factor is an attribute that makes an individual more likely, and the word is more likely. It doesn't mean that everybody would have it. And yes, so that is tricky. There are some diseases like malaria. Mosquito bites you, you get malaria. But this kind of condition, it's a conglomeration. Nobody really knows the real thing, but it's been observed that people with these risk factors are more likely to get it. And these risk factors are divided into, non-modifiable, you can't do anything about it, advancing age. So you see it more in elderly people, and the WHO